My name is Jessica and I'll be your nurse today, teaching you regarding how to lower your salt intake to decrease your hypertension.
Sounds good.
Okay, so I'm going to start you off by having you do this quiz.
Okay.
The sodium calculator is a good estimator of how much salt she eats on a daily basis.
So as we can see in the quiz, you are consuming about 7,000 milligrams of sodium per day. And the recommended salt intake per day is 1,500 to 2,300 in patients with hypertension.
Wow, that's not good.
Yeah, very shocking number. So I'm going to teach you today on how you can reduce that amount, okay?
Okay.
Modifiable risk factors associated with hypertension include unhealthy diets, which would be consuming a lot of sodium. There's a lot of cardiovascular complications that can occur with uncontrolled hypertension, such as chest pain, stroke, heart attack, or heart failure. So foods that have a lot of high salt content include fast food, processed food, pre-made bottled dressings, sauces, soups in a can, as well as snacks such as like chips and so on. Some key strategies to reduce salt would be rinsing vegetables and fruits before eating, looking at nutritional values of products in grocery stores prior to buying them, not adding salt during meal preparation, not having a salt shaker available at the dinner table, limiting snacks that are high in salt, and choosing low sodium products. So try not to buy packaged foods. Now I'm going to bring you two labels and I'll have you read them and tell me which one you think would be good and which one you think would be bad, okay?
Sounds good.
Okay.
So I remember you saying that sodium was bad, and I see that this one has 850 milligrams of sodium compared to 125 milligrams.
Okay.
Therefore, I think this one would be bad.
Yes, that is correct. So now I'll talk to you about some foods that have low salt content, which is what you'd want to buy in the grocery stores. So vegetables and fruits such as apples, oranges, bananas, spinach, carrots, broccoli, and so on. Bread, cereals, and other grains that have 5% daily value or less. So that would be things like quinoa or barley and whole wheat pasta, things like that. Protein foods such as chicken, but have also 5% daily value or less. Dairy would be fat-free or low-fat products, yogurt, low sodium, cheese, and soy milk. And then for dressings and oils, try limiting those condiments like ketchup and things like dressings that are in a bottle that have a lot of sodium, okay? We'll have a list of ingredients here, and I'll have you pick which ones you would like to eat for breakfast, lunch, and dinner, along with snacks for a good day, okay?
Sounds good.
In the morning, you'll have Greek yogurt, granola, and strawberries. For lunch, you'd have a salmon sandwich on whole grain toast, some dried mangoes and walnuts for a snack, some chicken, sliced peppers, red cabbage, and homemade guacamole for dinner. And then another snack would be apples with almond butter.
Sounds good.
Yes. And why would you think that we'd put almond butter?
Maybe it has less sodium
Then which ingredient?
than peanut butter.
Yeah, that's totally right. Okay.
Now I'll show you a short clip regarding how to reduce your salt intake.
Okay.
Now that the teaching session is almost over, I'm going to have you answer a few questions, okay?
Sounds good.
Okay, so what are 3 types of nutritious foods that are low in salt?
Fruits, vegetables, and proteins.
Yeah. What are 3 cardiovascular complications?
Chest pain, heart attacks, stroke, and heart failure.
Yeah. And what about 3 key strategies to reduce salt?
So I could rinse my vegetables when from cans. I could rinse them before I eat them. I could not have a salt shaker at the table so that it limits my want to add salt. And I could look at nutritional values of things just to make sure that they have a lower salt ingredients.
Good. And so, what is the ultimate goal after this teaching session?
To lower my salt intake and so that my hypertension can be decreased. I can have a normal blood pressure.
Yeah, that's totally right. Okay, so before you leave, I'm just going to give you a little pamphlet that you can take home and read over once you're at home.
Oh, perfect. That would be so helpful.
Yeah, and if ever you want to have any help with resources or anything like that, there are many resources online available, such as Hypertension Canada, Heart and Stroke Foundation, and don't forget to reach out to your doctor as well.
Sounds good. Thank you.
No problem.